going to go over some considerations for all the stuff that we just learned how to design and print. We're going to be using this on people. So things aren't as easy as, popping on the model and having everything be predictable. Things can go south. I'm here to tell you some tips and tricks on how to avoid that. If you guys have any questions on, some considerations you might have, or some things that can go wrong, or some things that have happened to you, like Tim said before with pulling crowns off, raise your hand. I'll flip through some slides and go over those things too. I'm going to start this section off actually with, it's a little bit sped up, but it's a full-length live video of a surgical guide being put on, an implant placed, and then the implant is restored with a printed restoration that you've designed. And all of these things you should be comfortable with doing from just this one course. The temporary implant, maybe next course will give you enough skills, or if you have enough time to play around at home with it, you can even do it yourself. I know with some people in the back, we played a little bit with the crown design and things like that. So after this, if you have some questions about that, just wave me down too. We can go over that. Let's click next. So this is a full-length surgery. I can kind of talk through what I'm doing here. So numbing the patient up. I don't know how many X times it's sped up, but quite a few. The main stress point of this video is that this makes your surgery so much quicker and so much more predictable. So here we're trying to guide on. So we already made sure the guide fits. We made all the necessary adjustments. We know for sure the teeth are getting hugged. It's in the right position. We laid the flap. So this is the flap being made. I'm holding the flap to the side and putting the guide back on. Once again, make sure the guide seats after it's being put on, because now you have a flap in the way. Any excess tissue, anything you changed, can change the fitment of your guide. So here is a series of drills. We're working at a diagonal, 6 through whatever our final depth/diameter is. And you can see we're not using any extra irrigation. She's just sectioning from the side, my assistant. And we're getting pretty close to the final drill here. There we go, I think that's about it. So in the surgery, I placed the implant by hand on the driver. I put it into the guide tube. This one we did with a cylinder, a metal cylinder. And then I attached the ratchet and hand torque it in. In this case here, I really wanted to make sure we have adequate torque because we are loading this patient with a tooth afterwards. So there's the pre-printed temporary on a tie base. It's going in. We're going to make sure it's nice and seated. We're going to make sure the contacts aren't in the way. That's where the floss comes in. She's a little sleepy. There we go. And then we adjust it out of occlusion, and we'll show you the final product of the day of surgery after this. So it's important to go over the steps of these kind of things because we're going to be doing this, and it's important to see how these guides are used before you use it yourself. So that's how she looked at the time of surgery. We reflected the buccal flap. That's a printed A1. I think that's one we used next gen MFH. We've recently switched over to the Onyx resin. It's a little bit stronger and a little more aesthetic.